Registration, counseling, testing. We have the professional donors. We need to have certain system to identify the professional donors. So it can be one very common thing is when we are asking the donor questionnaire. When we are asking counseling them, then we can find out a lot of things about them. You can, whenever you find any professional donors, what you can do is you can take a picture of it. You can keep it in a notice board which is visible to your staff only. Okay, so the staff can be cautious when these professional donors come again in the blood bank. Then the counseling questions. So the kind of question that assessor asks you is like, are you asking all the questions which are there in the questionnaire? Are you asking questions, very tricky questions like, do you have multiple sex partners? So such questions needs to be framed very tactfully, and you have to put it in the right professional way. Okay, and if there is a problem with the sex, like if the counselor is a male person, and if the person who has come for donation it's a female, then a female nurse should be called, and they need to ask those private questions. Okay, then comes your donor questionnaire. In the donor questionnaire, one very important thing is you need to have a part where you are taking consent for HIV and ECV test. Okay, without consent, you cannot do the HIV or ECV test. Okay, then in the testing part, very important thing is you need to have the HemoQ machine. You need to have it calibrated. You need to run QCs, daily QCs for that. Your BP apparatus, if it's a digital one, you need to calibrate it, get it calibrated. It should be updated. And also the weighing machine, it should also be calibrated.